Sophie is a 23-year-old part-time teacher with panic disorder. Her interview demonstrates the importance of good interviewing skills. The doctor teaches her the relevance of her anxiety symptoms and the use of hyperventilation control to manage these symptoms. One interviewing skill highlighted in Sophie's case is the reflection of feeling. By reflecting back to the patient the emotional aspects of their story, the doctor can create empathy and encourage the patient to say what really concerns them. In addition, this interview demonstrates the use of open and closed questions that were introduced with Bob. Open questions to allow the patient to talk broadly about a topic, and closed questions to learn more about specific information.
I'm worried and anxious.
About?
These attacks I'm getting. Mm-hmm. I'm so worried about them. I think I might be having panic attacks.
Tell me about them.
Well, the first one was about 4 months ago.
Mm-hmm.
I just had a typhoid shot before taking Josephine and my sister to Bali. I didn't want to take her, but Mum insisted. You know how Mum thinks that now I'm a teacher, I'm the responsible one in the family.
Mm-hmm.
Well, anyway, that night, all of a sudden I felt faint. I got really dizzy. My heart was beating fast and I was short of breath. Then I thought I was going to collapse.
That must have been really frightening. What then?
Well, I didn't. It sort of passed. I went back to the doctor down the road the next day and she examined me. She gave me an ECG.
Mm-hmm.
And said that it was probably some sensitivity to the shot and that I'd be okay.
Mm-hmm.
But I haven't been. I'm always on the edge. I worry that I'm going to have another attack. They're really awful. I've had probably about 10 attacks now. You know, I can go weeks without having one and then all of a sudden I'll have 2 in a row.
Can you tell me about your most recent attack?
Yeah, that pretty much the same thing, really. All of a sudden I'll get nervous. Then my heart starts beating faster. I can't get my breath.
Mm-hmm.
I start to get dizzy, a bit sick.
Mm.
And then I start shaking. And then I think I'm going to collapse or die for sure. But after a few minutes, you know, it feels like hours at the time. It sort of goes. Afterwards, I feel really shaken and exhausted and, well, a bit stupid to tell you the truth.
In the previous section, the doctor shows that she accepts and understands what the patient must have been feeling at the time of the first panic attack. The open questions at the beginning of the interview allow the patient to describe her experience of the first and subsequent attacks, allowing the doctor to assess the symptoms of panic. Note in the following section how closed questions are used to ask about 2 important issues in relation to the panic attacks. First, the factors that might trigger a panic attack, and second, the consequences of the attacks. In particular, the doctor should know the extent to which the panic attacks disable the patient, and whether any secondary avoidance of situations has occurred.
What brings the attacks on?
Nothing really. Well, that's not quite true. If I'm feeling tense, I feel one coming on. So I keep sort of checking on the symptoms to see if they're starting. In fact, the worry over having an attack is almost as bad as the panic attack itself.
Has it changed your life at all?
Definitely. I just don't feel safe anymore.
Mm-hmm.
I've given up drinking coffee, and I used to drink a lot. I've stopped drinking alcohol, not that I ever drank all that much. And I don't go out raging with my friends anymore. I just don't really feel like it. That's why I've moved back home. It's ridiculous, isn't it? I feel like I need someone there to look after me in case I have a panic attack, and I'm meant to be the grown-up of the family.
Is there anything else?
No, not really. I'm still going to work part-time as a teacher. So I just take a bus or a train on those days. I can't just stop everything. I force myself to go out and do things. I'm a bit scared that if I don't, I'll become a hypochondriac.
Good. It's important not to avoid situations because of panic. I still don't understand what was going on when the attacks began. A typhoid shot doesn't seem a likely explanation.
Oh no, it's not. I've thought a lot about it. 4 months ago was a low point. I finished my degree the year before last, but I haven't been able to get a steady teaching job. The temporary teaching is okay, but it's not what I really want to be doing. Then Dad had that heart attack, and Mum was devastated. I'm the oldest, plus I'd finished university, so I guess I was just expected to take over and do everything. And I did what was needed at the time. But the thought of having to take Josephine to Bali when she finished her HSC was just like the last straw. You know, it was so obvious that my needs were not important. Does all that hang together?
Oh, yes, it does. It makes a lot of sense. I've known you and your family since you were a child, and that's the way your mother sees you, as a second dad in the family. I can't change that, but I can help you deal with your panic attacks.
There are 3 important steps in the management of panic attacks. The first is to educate patients to recognise and understand their anxiety symptoms, so they are no longer fearful of the symptoms or their consequences. The second is to teach them to manage many of the physical symptoms through hyperventilation control. The third step is to advise patients not to avoid any situations through fear of their symptoms, reducing the risk of agoraphobia. In this case, the doctor has already established that the patient forces herself to go and do things, and firmly advises that she continues not to avoid. If avoidance is already well developed, specialist consultation is recommended. Educate patients to recognise and understand anxiety symptoms. Anxiety is a normal reaction. It's a series of changes in the body that enable us to deal with threat or danger. Changes that would be very useful if you had to escape or ward off danger. Symptoms associated with this fight or flight response include the list you see on the screen. When educating patients about their symptoms, it's useful to begin with an explanation of the fight or flight response. Think how you would explain symptoms described by this patient in this case. Then see how the doctor teaches these symptoms.
What is a panic attack?
It's a sudden attack of fear or anxiety in a situation in which there's no real danger. If there were danger, then the symptoms would be normal, or part of the flight or fight response, which would enable you to deal with the danger. You know, the heart beats faster to pump blood around the body. You need to breathe more frequently so that you're ready for any exertion that's to come. The nausea is because the blood is being diverted away from the stomach to the muscles, and the shaking is because of the muscle tension that you might need. Now, the dizziness is secondary, and that's because you're not using up all the air that you're breathing.
Okay, that's fine. But 4 months ago, I wasn't in any direct danger.
Well, no, but you were in a bit of a jam. You hadn't really established yourself as independent in a job. Your dad had nearly died, and your mum had pulled you back to be the second dad in the family. Taking your sister to Bali was a hint, I guess, of what might be in store for you. And I think the typhoid shot just gave you some symptoms to focus on.
But why do the attacks continue?
2 reasons. Firstly, because the core issue of your independence hasn't been solved. You're still at 6s and 7s. And secondly, because the panic attacks are so frightening that you keep examining yourself for any signs of anxiety, and you're responding with your own flight or fight response. Mostly, I suspect, by overbreathing, seeing dizziness and breathlessness as such prominent symptoms. Well, let's work through this information sheet together.
It is important that patients understand that hyperventilation can exacerbate anxiety. That's why the slow breathing technique used to control hyperventilation is so critical. Simple written material that patients can take home and learn ensures that important information is not missed or forgotten. The slow breathing exercise should be practiced regularly and used at the first sign of anxiety or panic. The patient is first asked to hold their breath and count to 6, not taking a deep breath. The patient then breathes in and out slowly through their nose in a 6-second cycle, breathing in for 3 seconds and out for 3 seconds, saying the word relax to themselves as they breathe out. This will produce a breathing rate of 10 breaths a minute. At the end of each minute, the patient is asked to hold their breath again for 6 seconds and then continue breathing using the 6-second cycle. They continue breathing this way until the symptoms of anxiety have abated.
And what should I do about it?
Well, understanding what's going on will be an enormous help. It's hard to get panicky when you know the process isn't harmful. But the second thing to do is to learn to control your hyperventilation.
How on earth do I do that?
By using the slow breathing technique. Essentially, this will stop you over-breathing and allow your blood carbon dioxide levels to return to normal. Again, I'll give you an information handout, but the essential part is when you feel anxious, you hold your breath for 6 seconds and then breathe in and out on a 6-second cycle. While this is simple to do when you're calm, it's very difficult to do when you begin to panic. You need to practice it over and over so that it becomes automatic, no matter how upset you feel.
It can't be that simple.
Of course it isn't, but using this technique will take the sting out of your panics. Understanding what's going on and knowing that you can control it will put you back in charge of your life. But as I said before, don't avoid situations for fear of panic. You've got to go to work still, exercise, go out with your friends. Don't stay sheltering at home.
Would I be better off with medication?
Well, not really. The SSRI antidepressants do reduce the severity of the attacks, but they don't allow you to be in charge. I suspect someone like you would be better off learning how to manage this yourself. If you need more information, there's a list of self-help books on the handout.
Okay, I'll try. But I still don't see it as that simple.
You're a teacher, look at it this way. All I've done is given you things to learn and do. Carrying them out may not be simple, but staying ignorant won't get you very far either.
Okay. Okay, that's fair enough. Is it okay if I come back and talk through things again?
Of course, come back in a few days and then every couple of weeks till you get set. I want you to keep a diary of all your panic attacks and the symptoms, what you did and how it went. And keep a list of all the situations you avoided for fear of panic. We can review the diary together each time you come back.
Both the doctor and patient were right. Managing panic attacks is not always simple. What else should the doctor have done to encourage the patient to take charge of her symptoms? To improve the chances of success, it is important to give an information sheet and to actually teach patients the slow breathing technique in the consultation. Lastly, it is important to prescribe a regimen for regular practice.
Can I come back in and talk things through again?
Of course. But before you go, I want to make sure you understand the slow breathing exercise. Here's the sheet I told you about. The exercise essentially requires you to slow your breathing down to a 6-second cycle. Now, it's important to keep your breathing as natural as possible, though it may not feel very natural at the time. Let's try it. I'd like you to use your watch to count the seconds. Okay, you can start now, and I'll tell you when to stop. So I want you to hold your breath as long as it feels comfortable. Don't take too deep a breath. And breathe out. Now breathe in through your nose. 2, 3, and out. 2, 3. How did that feel?
Bit strange. It certainly doesn't feel like normal breathing.
No, that's okay. It will improve with practice. Also, remember that I said before that the breathing exercise really has to be automatic. It's not going to be very useful if you find yourself in a panic and you can't remember what to do. Okay, regular practice will also make the exercise more automatic and therefore useful in most situations where you find yourself becoming anxious.
Well, how much should I practice?
4 times a day is a good start. I suggest you get into a routine of practicing for 5 minutes in the morning, at lunchtime, when you get back from work, and before you go to bed. Do you think you can manage that?
I might just write it down so I remember.
Okay, now come back in a few days and then every couple of weeks until you feel set. And keep a diary of all the panic attacks, their symptoms, what you did, and how things went. Also keep a list of any situation you avoided for fear of panicking. Well, you can review the diary together when you come back.
Okay, thanks.